Hey guys, Scotty here with Strength Rebels. This is the hip hinge video, the hip hinge assessment video. If you haven't seen our main assessment video that talks about the process of our assessment, make sure you go and have a look at that one first before you view this one. So for the hip hinge, as we know, the hip hinge is one of the most important movements that we would do for really any of the main structural 6 exercises that we would do, and a lot of the movements in life definitely translate specifically over towards the deadlift and the squat and anything bent over as well. So the process for this is we're looking, remember, for 2 things. So we've done the positional screen. So after you've done the positional screen, you would go straight on to this being the first part of our assessment, the hip hinge. Okay, so what we're looking for are 2 things. We're looking for, does he have some degree of motor control? And what we mean by that is, does he know how to bend at the hips without bending at the lumbar spine and be able to control that? The second part of it is the range of motion. So then we're looking at, if he does have some degree of control, how much range of motion does he have under control? And that might be an active control issue, or it may be a pure passive mobility issue. And so that's part of the assessment, what we're going to get to. So with the way this works is we're going to get Coach Chen to stand in his good normal upright posture. He's going to face towards the side, so that's usually the best view that you can see. What we're going to get is start him with his hips about hip width apart in a natural amount of turnout. Now we can change that later on. We can change it if we want to have a look at his hip mobility in different planes, that's fine. But start off about hip width and a little bit turned out. He's going to start off nice and tall. He's going to start off with not full retraction, but just sort of our normal position that we talk about in the position screen. Lumbar spine in his neutral, whatever neutral is for him. Okay, so what we're going to ask him to do are a couple things. One is going to be bend forward, but don't get in the habit of just saying bend forward. Because really what we're looking for is we're looking for the hips to translate back. So what will often happen if Chad does this wrong and I ask him to bend forward, he's going to come all the way forward. The hips don't translate backwards as much as we want them to, and that's not really the position that we're looking for either a deadlift, a squat, or the hip hinge itself. So we're going to ask him to shoot his butt backwards, have the shoulder come forward, and so he's bending at the hips with no movement at the lumbar spine. So best position for this is usually if I'm behind or a little bit on the side, I can see how far he's going to be going. Okay, so he comes back up. All right, so what I'm watching for, if Chad goes part way down, I'm watching for movement here at the pelvis as well as the lumbar spine. So if the shirt's tight, you can usually see that, or we get them to peel the shirt off. Okay, so in this case, what I'm looking for is, and what I primarily watch first is what's happening with the pelvis, because that's going to be dictated by the hip range of motion and mobility. So I'm looking at what is the point where that pelvis stops moving, and that would be his end range of motion. Okay, so the pelvis has stopped and he continues on. You can see the movement happen at the lumbar spine. Okay, so the first aspect, if we're talking about motor control, what we just go on back up, Chad. What we want to look at is, can he do that at least initially? So can he do the movement to start with? Can he bring his bottom back and his shoulders forward while keeping a neutral spine? What you'll see a lot of people do is, as they start doing that, they might be able to bring the hips back, but they'll actually get some flexion at the lumbar spine. So if Chad starts doing that, you see right away he's starting to flex. This to me would indicate that likely there's a motor control issue or just a processing issue that he doesn't understand the movement necessarily. So assuming that he can keep that position and he has a good sense of that motor control, at least at the outset, I want to see how far he can go. So Chad, I want you to keep your good position, and I want you to stick your bum back, bring your shoulders forward, and I'm watching this pelvis and I'm watching his lumbar spine. Stop there. Okay, so I felt his pelvis stop. So I've got my hands right on his iliac crest, and I can feel when that pelvis stops moving. So at this point, what I really want to know is, did he stop, or did his pelvis stop because he doesn't have the motor control to continue, or is it a range of motion issue? So what I'm going to do is I'm going to say, okay, Chad, stay in this position, and I'm going to try and tilt you forward more. And you can see he gets just a tiny little bit more movement, so he doesn't have necessarily the active control right at this bottom range to be able to go all the way into the full range of motion with the tension that he's feeling. And I'll ask him, Chad, do you feel tension in your hamstrings right now? And he's going to say yes if he's done this right. So if he does get a little bit of movement here when I do that, then likely there's a bit of an end range motor control issue at the end range of his motion. If there's no motion, if I go, okay, Chad, let's try and tilt more, and he's not tilting anymore, As he's going forward, then likely it's a range of motion issue, and again, I would ask about the hamstrings, because likely it's the hamstrings under tension, or maybe in the hip socket itself. So if you were to go further than that, so let's just do that again, Chet, down to that position. Okay, try and go further, try and bend down further. Keep going, keep going, keep going, keep going. You can see that the movement now, because he's reached his end range hip flexion and pelvic tilt, that all of the rest of the motion is coming from compensation in the lumbar spine. Okay, come on, back up. Okay, so what this is going to tell you is this is going to tell you, A, does he have the motor control? So you go down that left-hand side of our assessment path. If he does have the motor control, we then take it over and say, well, how limited is that? How far can he go? So the one rule of thumb that we have is we actually look at the thumb position when he gets to his bottom position to look at whether someone could potentially have a full deadlift or not. So Chad, go to your bottom position through the hip hinge, having a look, feeling the pelvis, making sure it's in neutral. This is his bottom position. Make sure you have straight arms. Okay, hold that position. How far down does he get? So our rule of thumb is if he can get his thumbs to the base of the patella, so basically thinking that the bar would be clearing the bottom of the knees, then with his position in his back position in a neutral lumbar spine, then likely he's going to be able to do a proper deadlift with being able to bring the bar all the way down from the floor. If he is a bit limited here, we may have to look at some mobility regressions, which is again that other path on the assessment. So make sure you have a look at that. Comment, make sure you subscribe and like, and keep watching for more videos. Thanks.